Uterine fibroids. Between 20 to 40% of women aged 35 or older develop uterine fibroids, growths that develop in the walls of the uterus. While fibroids do not always cause symptoms, their size and location can lead to problems for some women, including pain, mass effect, and heavy menstrual bleeding. Almost all cases of fibroids are non-cancerous, but they are still the leading cause of hysterectomy in women, resulting in approximately 200,000 such surgeries annually in the U.S. Hysterectomy is the removal of the uterus and is considered major abdominal surgery. It requires 3 to 4 days of hospitalization and a typical recovery period of 6 weeks. The alternative to this highly invasive surgical operation is less invasive transcatheter uterine fibroid embolization, or UFE, performed by an IR physician. UFE is accomplished via a small groin puncture through which a catheter is then guided into the pelvic arteries supplying a uterine fibroid. The benign tumor is then injected with tiny plastic particles that deprive the tumor of its blood supply and cause its shrinkage. The procedure usually lasts 1 to 2 hours and is either conducted on an outpatient basis or may require an overnight stay in the hospital. Most women can return to their usual activities and jobs in about a week. UFE results in significant or total relief of heavy bleeding, pain, pelvic pressure, and or mass-related symptoms in 85 to 90% of women undergoing this procedure. The procedure is effective for both multiple and large fibroids, and the recurrence of treated fibroids is very rare. UFE has been performed since 1995, and the embolic particles are approved by the FDA specifically to treat uterine fibroid tumors, based on comparative trials showing similar efficacy with less serious complications compared to hysterectomy and myomectomy, or the surgical removal of fibroids. UFE is covered by most major insurance, and although it is preferred for patients who do not want to become pregnant, many women may still have the ability to conceive following this procedure. Once again, less invasive IR technology is providing women with a more desirable option in the treatment of this frequently crippling condition.